focusing on breast cancer and cancer prevention. Dr. Norder, tell me a little bit about self-breast examination. I know that's a very important thing when women get into their early 20s and 30s to start doing that, practicing it. Tell me, I know you have some stories. Tell me one at least.
Well, a couple things. I'm a big proponent of self-breast examination, excuse me, and I think our entire office is. And so we really get started early related to women in their pregnancies in general, because when they're that young, invariably we're seeing women in childbearing age, obviously typically 20s and 30s. And so we start teaching it at that point in time. And I really encourage women to do breast exams monthly, even when they're pregnant, even when they're breastfeeding, through their whole life. All women, including obviously and even more important after the age of 50. Then it becomes really important. Two examples that I have recently, two of my patients that I know very well delivered several babies for each of these young ladies who are both under the age of 40, recently found breast cancer on their own self-breast examinations. Fortunately, they caught it very early, and they were, have had overall so far good results. It's still, an early phase, but I have every reason to believe they're going to have a complete cure. But it's just because they were being thorough and doing their own self-breast exams and brought it to my attention, and then from there we moved forward with further diagnosis, and then on to a surgeon. A general surgeon is who handles breast cancers at the point that you need surgery. We don't do that surgery here. But they're doing very well, and thankfully, and I would give it all credit to self-breast examination.
And that's pretty easy to do. Like if you're in the shower, you just...
Very easy, very easy. When I talk to people about self-breast exams, we go through 4 basic principles, and those are to look first, to feel second, then third, you want to check your lymph nodes, and that's, of course, under your arm, and that's very important. And then just pay attention if you would ever notice any kind of discharge, which, is more typical, obviously, related to breastfeeding or something like that. However, if it was ever a bloody or a dark discharge was noticed, then that's something I want people to, they need to let us know then. It doesn't mean you have breast cancer, by the way, but then that's when we want to take it to the next level and make sure that you don't.
Yeah, exactly. Do you have specific breast... where you go and get tested for specific breast cancer screenings?
Yes. I mean, the obvious and the general screens are, we strongly encourage women to do, in the ideal world, we should really be doing a mammogram at least at the minimum every other year when you're 40. I prefer the American Cancer recommendation, the American Cancer Society recommendation, which is every year from age 40. And this is in a low risk or a non-risk patient who has really no family history. Based on your family history, you might do further testing, and those can be both diagnostic mammograms and high-level ultrasounds, particularly in younger women, which are very helpful in finding breast cancers early. And then more recently, there's a lot of it's becoming much more common to do what we call the BRCA, that stands for breast cancer, gene 1 and gene 2 testing, which we can do here in our office, and it's actually a swab. They just take
like a DNA test.
It is exactly what it is. Okay. And it's just a swab from the inside of your mouth, and it usually takes 1 to 2 weeks to get a result back. But if you have a significant family history, that test can become very important. And equally as important for someone, for example, the 2 patients that we recently diagnosed, they would want to come in and do that testing after you've already been diagnosed with breast cancer, because that really helps them determine how important it is for their children, especially their daughters, to evaluate or pay attention for breast cancer for the rest of their lives.
So you do that screening here, easy, very simple.
Very simple. It's just a little swab inside your mouth.
Do you also do mammograms here?
We do not do mammograms here. We send those out, and we don't do breast ultrasound. We do a lot of ultrasound in here, but primarily it's for gynecologic reasons or obviously a lot of obstetric ultrasounds.
And you also do a lot of pap smears for cervical?
Yes, we do. Yes, we do. And I believe that Dr. Blackett spoke about that earlier, but we're still strongly encouraging people to do pap smears. The criteria have been changed. I won't go into too much detail there, but the important thing that I would emphasize, and probably Dr. Blackett did, is the importance of still doing an annual exam. We might in actuality, we're doing less pap smears now than we used to, because the frequency really has gone down on what's required, particularly if you're low risk. But I think a lot of people have mistakenly thought or assumed that that means you don't have to come in for an exam, for your annual exam. And you absolutely do. We still want to do a full exam on every patient every year.
Very good. Well, I appreciate you and your time, Dr. Norda. And,
Thank you.
And being aware of our bodies is very important, and that self-breast examination is something that you can catch something very early.
It really is. It literally can save a life, and I can think of, those are just two recent ones. I can think of other people, some that work in this very office.
And if you have family history, make sure you
Absolutely.
check that sooner.
Yes, the sooner the better.
Well, thank you so much. Appreciate it.
Thank you.